Now we need to discuss about the axillary nerve. So you can see this is the axillary nerve. This axillary nerve is actually divided into two branches. One is the anterior branch. You can see this one. This is the anterior branch, and it is divided into the posterior branch also. So this is a posterior division of axillary artery. So like this, the axillary artery is divided into anterior and posterior branch. So this is a anterior division. This is a posterior division of axillary artery. So why we need to study the axillary artery? Because it's very important in supplying the important muscle, that is the deltoid muscle. You know the deltoid will be here. So as this one. So as the deltoid muscle is mainly supplied by the axillary artery, it's important to know because deltoid is the main abductor of the arm. So to move the hand towards this side, you need especially this axillary artery. So surgically also it is important because commonly involved in dislocation of shoulder and also in fracture of surgical neck of humerus. So clinically also it's important because whenever there is any dislocation of shoulder or fracture of surgical neck of humerus, then the axillary artery will be affected. Axillary nerve. So actually axillary nerve is a branch of posterior cord of brachial plexus. So in a brachial plexus, if you see, we have lateral cord, middle cord, posterior cord, right? So posterior cord give rise to this axillary artery. So its root value is C5 and C6. Its root value is a ventral rami of cervical segments 5 and 6 of spinal cords. So coming to its course, the axillary nerve courses through lower part of axilla into quadrangular space. So you know what is quadrangular space? In the before video we discussed. In quadrangular space, superiorly you will have the teres minor, and medially you will have the triceps brachii. Laterally you will have the humerus, right, medial border of humerus, and inferiorly you will have the teres major, right? So that is a quadrangular space. So in that quadrangular space, this axillary nerve terminates and divided into two branches. As I said, it is divided into anterior division and posterior division, right? It is dividing in the quadrangular space, that you need to remember. So this is a quadrangular space. Here it is coming and dividing into the anterior and posterior division. So relations, it's in the lower part of axilla, right? It is in the lower part of axilla. The nerve runs downward behind the third part of axillary artery, and it lies on subscapularis muscle, and it is related medially to median nerve and laterally to coracobrachialis. So medially it is related to median nerve and laterally to the coracobrachialis muscle. So this nerve leaves the axilla mainly by winding around the lower border of subscapularis in close relation to lowest part of capsule of shoulder joint and enters the quadrangular space. So that is how it is entering the quadrangular space. So this nerve then passes backward through the quadrangular space, and it is accompanied by posterior circumflex humerus vessels. So if you see here, it is mentioned posterior circumflex humeral artery. So mainly its anterior division is in contact with posterior circumflex humeral artery, and the anterior division only supplies the deltoid muscle, you can see, whereas the posterior division, if you see, it's supplying mainly to the teres minor muscle. So this is important, which branch of axilla nerve is supplying which muscle. So anterior division supplies deltoid, posterior division supplies teres minor, and anterior division is running along with the posterior circumflex humeral artery. That is also important. And so superior to the axillary nerve you will find the subscapularis. This is axillary nerve, so superior to it you will find the subscapularis muscle, and the lowest part of capsule of shoulder joint is also present superiorly, and also you will find the surgical neck of humerus. These are all the superior relations, and inferiorly you will find the teres major muscle. So you can see this is teres major muscle inferiorly, and you will find medially the long head of triceps brachii, right? So this is all we already seen in the quadrangular space. And in quadrangular space, the nerve divides into anterior and posterior branches in relation to the deltoid muscle. The anterior branch is accompanied by posterior circumflex humeral vessel, and it winds round the surgical neck of humerus deep to deltoid. It reaching the almost up to anterior border of muscle, you can see. It's reaching up to anterior border of muscle, supplies the deltoid and skin over the anterior inferior part. Then it's coming to the posterior branch. It supplies teres minor and posterior part of deltoid. It also supplies the posterior part of deltoid. and the nerve to the teres minor bears a pseudoganglion. That is important. You can see here this is the pseudoganglion. So pseudoganglion is also only present in the posterior division of axillary nerve. So this posterior division of axillary nerve later pierces the deep fascia at the lower part of posterior border of deltoid, and next it continues as the upper lateral cutaneous nerve of arm. You see here, this is the upper lateral cutaneous nerve of arm. So we need to remember like in which division what is present, that is important. So once again let us recall it. So axillary nerve passes through the quadrangular space, and in the quadrangular space only divides into the anterior division and the posterior division. The anterior division is mainly supplying the deltoid muscle, and also it is passing along with the posterior circumflex humeral artery. And the posterior division is bearing a pseudoganglion and supplies the teres minor muscle, and also the posterior division is forming the upper lateral cutaneous nerve of arm. So this is a simple overview of our axillary or circumflex nerve. Remember, it is axillary and also called as circumflex nerve because it is winding around the surgical neck of humerus. So clinical also, if there is any fracture in the surgical neck of humerus, then of course the axillary nerve is getting injured here. So that's it with this video. Next we'll start with anastomosis around scapula and also anastomosis around the acromion process.